In this presentation, I would like to talk about Viagra, how does it work, and what exactly does it do to your body when it's there. I hope this information will eliminate any myths or any wrong information that exists, and also will improve your understanding on how to control your sexual health. Before we move on, let's just quickly talk about its invention. So, Viagra was invented by two British scientists, Peter Dunn and Albert Wood, in 1989, and it was an accident because the scientists, they thought that this will be the treatment for high blood pressure, angina, and also chest pain associated with coronary disease. But as a treatment, it failed. However, what they noticed is that it improved erection. And they started to use this blue pill as an oral treatment for erectile function problems, and Viagra was launched by Pfizer pharmaceutical company under the name of Viagra in 1998. And now it's a multi-billion pound business. Viagra is known under different names, and it depends on the trademark or country where you're buying this drug. But first, Viagra was commercially introduced under the name of Viagra, also known as sildenafil. Then came Cialis, known as tadalafil. Cialis has effects that last longer. Then came Levitra and Staxin, known under the trademark of vardenafil, and then came Stendra, Avanafil. These are the most popular approved drugs that operate in a similar way. But you might come across also names like Udenafil Zidena, Mirodenafil Vix, and Lodenafil Heleva. This is just for your information to be aware what these drugs belong to. And Viagra, also known under the name as PDE5 inhibitors. When a man who has erectile function problem takes Viagra, he has to be sexually excited, because otherwise Viagra will not work. And if he's sexually excited, sexual excitement in combination with this drug enables the arteries in the penis to widen and the spaces in the erectile chambers to fill with blood. And as the veins in the penis expand, they trap blood in the penis for a prolonged period of time. So that allows this man to enjoy his sexual activity longer. However, it's been noticed that these drugs only effectively work with men who have organic biological reasons for erectile dysfunction problems. If man has psychological factors or tries to use these drugs in order to enhance his sexual performance, these drugs will not work. Prior to 1998, when Pfizer launched Viagra, known as Magic Blue Pill, the only options for erectile dysfunction treatment was surgical implantation of penile prosthesis, similar to breast implant, or the use of vacuum erectile device that has a look of a toy and quite often advertised at the back of men's magazines. But of course, the arrival of this magic blue pill was a revolutionized treatment for erectile dysfunction. However, what's important to understand that these pills are not aphrodisiacs and they are not cures for sexual problems. They will not work in the absence of desire, nor will they make an erection any harder or longer than what was normal for a man before he started to experience erectile dysfunction. So all the aspects of sexuality like attraction, desire, arousal, and orgasm have to be present in order for this pill to work. because the main organ that decides about erection is brain. So when brain is stimulated by sexual stimuli and sexual fantasies, it sends a signal to penis through nervous system saying that sex is about to happen, and this signal releases nitric oxide, commonly known as a laughing gas, and historically used by dentists for anesthesia. So this nitric oxide is released in penis, and it causes the relaxation of the smooth muscles within the penis. And what it does, it allows blood to flow freely into the spongy tissue. And this is basically produces firm erection. At the same time, the veins that take blood out of the penis constrict, and this constriction keeps the blood trapped in the spongy tissue until the sex act is completed. So these pills are called PD5 inhibitors because they inhibit the chemical that breaks down nitric oxide, because it's this breakdown process that causes loss of an erection. So by blocking the breakdown, these drugs create a longer period of smooth muscle relaxation in the penis and allowing the penis to stay erect for longer. But what's important to understand is that these drugs are not a desire drugs. They are just capacity drugs that give a man the capacity to exercise his sexual potential. So if, for example, there are problems in relationship, then these drugs will not help, because love making and sex in general involve intimacy, sensuality, emotional connection based on trust, respect, and caring. And if one of these components is absent, these drugs will not help. So these drugs only help individuals to revive and maintain the sexual aspect of already healthy relationships. So it's quite important to understand this moment. And also, it's been noticed that these particular drugs, they are especially effective for patients who have erectile dysfunction due to spinal injuries or as a result from surgery for prostate cancer, because they're quite easy to use, and also you can use them discreetly as well. And they also, in order for work, they require sexual stimulation. So they kind of, when a man takes them, they look quite natural, unlike other ways of dealing with erectile problem, for example, when they use injectable medications. So unlike that, these drugs are very easy to use, but they are not drugs that will resolve conflicts in relationship or any psychological factors that contribute to erectile dysfunction. It's important to understand that Viagra should never be bought over the counter without medical prescription, because if there is erectile dysfunction, the first thing that is important to do is to find out what is causing it. If the contributing factors are psychological, Viagra won't help. If contributing factors are biological, organic, then it's important to find out which ones, because erectile dysfunction can be an early indicator of a potentially serious underlying vascular and endocrine diseases. And taking any of these drugs without a full medical evaluation can complicate these conditions to a life-threatening degree. So, for example, if a patient with erectile dysfunction has silent, undiagnosed coronary heart disease and takes any of these drugs, he could suffer a fatal heart attack while having sexual intercourse, and cases like this are known. So, Even though these pills are relatively safe and they carry minimal side effect, they are still drugs, and they can cause life-threatening conditions because of the underlying cause. So it's not erectile dysfunction that is a problem, it's what's causing this erectile dysfunction that could bring to a life-threatening degree, life-threatening condition. And especially if these drugs are taken with any form of nitrates, like nitroglycerin or organic nitrates or porpoise amyl nitrates, drugs that are commonly used in patients with coronary artery diseases. And the most significant side effects are minor and include headaches, facial flushing, nonspecific back pain, alteration in perception of the color blue, and heartburn. And all these drugs have the ability to dilate blood vessels, and when taken in combination with certain other drugs like nitroglycerin, for example, they may cause a sudden drop in blood pressure, and that can lead to death. So it's quite important to understand that Viagra is not something that you can take just for recreational purposes or just to improve your erection, because it doesn't work like this. Viagra is a serious drug, and it can only be taken with the doctor's prescription. In order to understand how Viagra or PDE5 inhibitors work, it's important to understand the science of blood flow, and I will try to explain it to you as simply as possible. However, it's a very complicated process, and it has a lot of medical and scientific terms that you don't need to remember. All you need to do is to have a basic understanding of what is happening in your body during erection and how they use Viagra or PDE5 inhibitors in order to improve erections. So what is important to understand is that we have only one pump in our body, pump that supplies different organs with blood, and this pump is called heart. So at different times, our body parts require different amounts of blood, and it depends on what we are doing. And another organ that decides how much blood has to be supplied to different organs is brain. So what brain does, it basically turns on or off valves of the arteries, and in that way it regulates the amount of blood supplied. So during sexual arousal, brain receives signal, sexual arousal signal. And after that, it immediately sends a signal down to a particular nerve fiber. And this nerve fiber ends in a nerve cell in an artery. And that's where this artery located where the level of blood has to be changed. And these nerve cells, they're called NANC, or full name is non-adrenergic, non-cholinergic. Very complicated, no need to remember that. So these nerve cells, they produce nitric oxide. And when nitric oxide is injected in blood and surrounding cells, it stimulates another enzyme called guanylate cyclase. So guanylate cyclase starts producing chemical called cyclic guanosine monophosphate, or cGMP. So what does cGMP does is it relaxes smooth muscles in the artery, and that allows arteries to open up completely and blood come in. So the more cGMP is produced, the more blood is able to enter penis, and the harder the erection becomes. But there is another enzyme that is called phosphodiesterase, or PDE. And this enzyme is working all the time in order to deactivate the process of cGMP, in order to prevent CGMP basically relax arteries and allow blood to come in. CGMP is produced as long as brain keeps sending signals, because as soon as brain stops sending signals, then CGMP goes away and then PDE takes over, and that's when erection stops and penis goes back to its flaccid state. So this is basically the process that demonstrates that everything is controlled by brain. And brain basically does whatever it wants. It either puts valves on or off. And when brain is sexually aroused, it sends signals to penis. Nerve cells in the penis's corpora cavernosa start producing nitric oxide. Then it leads to the production of CGMP. CGMP causes the muscles in the walls of arteries to relax, and that allows extra blood to flow in and to stay there as long as it can, and that basically helps to have strong erection. But one of the most common reasons for erection problems is that arteries in the penis aren't dilating enough when the brain sends signals. So a man can be sexually aroused. The nerves in the penis can produce nitric oxide, but the amount of CGMP isn't enough to maintain it. And that's when PDE5 inhibitors or Viagra eliminates the PDE. And it allows a CGMP build up in the penis and have larger effect on the artery walls. So the greater amount of CGMP in the body, the more blood goes into the penis and the stronger erection is. So what I would like you to understand is that even when you take Viagra, remember that there still has to be sexual arousal, because it's still controlled by the brain. There is a big misunderstanding that if you take Viagra, you're going to have erection regardless what. No, it's a big misconception, because even if you're taking Viagra but you're not sexually attracted or you're not sexually stimulated, it will not work. I hope this explanation is clear. Understand the fact that Viagra is not a panacea and it doesn't treat all the cases of erectile dysfunctions. In fact, it can make the situation worse. So if you suffer from erectile dysfunction, the first thing to do is to make an appointment for a medical evaluation and find out what is contributing to your condition, because the treatment will be different depending on what will be found out. And once the problem is identified, once the contributing factor is identified, then the treatment is dedicated to eliminating of this contributing factor, not the final result of it. So understand the fact that there are a lot of healthy alternatives that can help men to stay healthy and sexually active till the rest of his life. And I talk about this in my next videos.